For this lesson, we'll focus on the 4 P's of the Student NPHub clinical practice, which is professionalism, practicing a new role, playing with new balance, and preparing for the next steps. Professionalism is dealing with how to conduct oneself with responsibility, integrity, accountability, and excellence. We have had to master this principle as nurses, but in this new role, there are new requirements we have to get used to. We recommend that you arrive early. Confirm your schedule with your preceptor and stick to it. Be respectful of your preceptor's schedule. Notify them if you're running late or if you plan to miss a day. Learn to cultivate an interest in learning new things and an eagerness to try new things. Familiarize yourself with the steps to common procedures and equipment. Check with your clinical preceptor if you have questions about equipment and how they function in practice. Remember that preparing for a procedure or a task is 80% of the work in almost anything you do in clinical practice. That means study the procedure or the exam before doing it and gather what you need. Have it ready and anticipate any potential roadblocks. Closely observe your preceptor and learn to anticipate their next move. The more you study them, the more you'll be thinking right alongside them. Do not give in to fear. It will hold you back from living your best student life. Acknowledge it, but don't let it dictate your behaviors in clinical. Get in there. We all have to learn somehow. Practicing a new role involves 2 major concepts that will help you master this new NP role: critical thinking and communication. Critical thinking is a familiar concept for nurses. After all, it's what we do on a daily basis. However, now you are a provider. This role change requires a whole new set of thinking skills. You are no longer waiting for orders as the nurse. You are placing them as the NP. Exhibiting critical thinking means asking the appropriate questions based on your existing knowledge of the material being reviewed. This allows for the preceptor to fill in any knowledge gaps. Here is an example. You have a patient on metformin who's experiencing diarrhea as a common side effect. You might ask if it could be reasonable to try a different medication, as this could be a barrier in him not taking the medication daily. Trying a different medication that may have less GI side effects could increase his compliance and bring about a lower blood sugar. Saying to your preceptor, "I have some ideas. Can I share them with you and get your perspective?" This is the work of a nurse practitioner who's using her critical thinking skills. Having a working knowledge of a given specialty allows you to think ahead for patient outcomes, medications to prescribe, and any exam and procedures you might need to order, and what follow-up is needed. Our booklets will help you with this, but writing down anything from the day you need to go home and review is also helpful. This can help you later in practice and even in your classes to help tie concepts to real-life examples. You know how to communicate already as a nurse, but again, this new role requires a new set of communication skills. Start by telling your preceptor your interest, learning styles, knowledge gaps you discover, or questions you have during your clinical experience. I remember loving when students came to clinicals with the goals for their clinical experience. It shows initiative. Having a plan, even written, for what you are hoping to do or experience, such as a pap smear or a surgical procedure, can be a great way to communicate. Be honest. This fosters an environment of learning and builds trust. Think back to your work as a nurse. You had to trust your nursing coworkers. This role is no different. If you are nervous or don't know something, tell them. Don't pretend. They will find out and it'll dismantle your working relationship. Your preceptor should help you work through your barriers to build your confidence. Always be honest. Don't be afraid to ask questions. Preceptors love students that are interested in the material and eager to learn. Remember, your preceptor wanted to have a student. That's why they signed up to precept students. Sometimes, based on the busyness of the clinical setting, it might be ideal to set time aside from seeing patients with your preceptor to go over questions that you have from the day or the week. Pick a time of the day or week to do so that you can feel heard. As you progress through your clinical rotation, you should require less input from your preceptor as you begin to master your new role as the nurse practitioner. Ultimately, they are responsible for the patient, so be sure to establish clear expectations early on in the clinical rotation and amend them as you both get to know one another. Do not fear taking on more responsibility. If your preceptor offers new opportunities to move you from an observational role to a semi-independent to a later independent role, that means that they are trusting you and seeing your growth as a student. Embrace the challenge. If the new change in the role feels daunting and, dare we say, unsafe, be sure to communicate that you aren't comfortable and constructively offer ideas for how you would feel more comfortable in the task they recommend for you to perform. An example of this could be, I understand that you're wanting me to assess the patient alone. I feel comfortable obtaining the history of present illness and the review of systems alone, but could we perform the physical assessment together once or twice and then let me attempt it on my own? Explaining that you feel comfortable with doing it alone and then how you can step into the responsibility they are expecting from you will demonstrate your willingness to learn and grow. One of the biggest challenges in the NP role is presenting a patient case. I remember the struggle in clinicals presenting to a preceptor. I would get so nervous, palms sweating, and stumble all over myself when speaking. Remember, we were all new at this at one time, and you are practicing. Give yourself grace, but do not stop practicing. The only way you get better is through repetition and accepting feedback. We have a section in the clinical workbook that walks you through how to present a patient. Implement the framework and make sure that you don't miss the important parts when presenting your patient. It's going to take practice to improve communication, so don't give up. There are so many barriers to communication, such as culture differences and age differences, so find new ways to explain what you're trying to convey. We would be remiss if we did not discuss if you're having issues with your preceptor's teaching style. If you have implemented the above principles and are just not feeling heard, we have a couple tips to help you convey your concerns. Set aside a private setting at a dedicated time to discuss your issues. Face-to-face is best. Maintaining the relationship is the goal. Explain how you felt during the learning interaction. Include positive and constructive feedback and provide alternative solutions. Use I messages when discussing your issues with the teaching style. For example, I feel very overwhelmed when being asked many questions on the spot, and I feel that it isn't conducive to my particular learning style. Offer an alternative or brainstorm how to find common ground. And ultimately, be adaptable. It can be frustrating and discouraging if your learning style is different from your preceptor's teaching style. Continue to strive to be successful in your environment and learn as much as possible in a new way. Someday, you'll be a preceptor, and you can use your own style with your students. Take heart. Feel free to reach out to NPHub if a preceptor is problematic and attempts to improve the experience are failing. They can reach out and help resolve issues if possible. Playing with new balance as an NP student. There's a lot to balance. NP classes, homework, and 500 to 600 hours of clinical work, compounded by obligations with family, career, and self-care. The mission of graduating from NP school can begin to feel impossible. We see you and we know it's hard. Take heart, we've all been there. One strategy is developing time management skills. NP school is about managing the items on your to-do list. Finding tools that help you stay organized is essential. Digital calendars, organizational apps, to-do list, and planning are the best ways to keep on schedule. Be realistic with your time. We have provided you some app recommendations to help your clinical knowledge, so be sure to check those out if you need some ideas. Reflecting on each clinical day is a good technique to keep the information fresh in your mind and helps to digest the day. At the end of the clinical day, get a journal and jot down what stood out to you, what you enjoyed, patient experiences, and what made the day productive or difficult. Practice self-care and find ways to manage stress, such as journaling and taking care of your health. Make sure to avoid burnout, which can lead to errors, depression, and anxiety. Preparing for next steps. Once your clinical experience is over, you might be wondering, what now? At the end of your clinical experience, you should get feedback from your preceptor. This input should be about how the clinical time went and ways that you could improve. This feedback is very important to your growth as a nurse practitioner, and you should receive the feedback with grace and view it as a gift to make you better. We advocate that feedback should occur throughout the whole rotation so that any concerns or changes that need to be made can be worked on throughout the semester. Most of the feedback shouldn't come as a complete surprise. Be sure to view the feedback at the end of your clinical rotation as a way to improve your next clinical rotation. Remember, feedback is meant to help you be the best nurse practitioner you can be. At the end of your rotation, look for mentorships. These are relationships in which a more knowledgeable person nurtures the professional development or growth of another. We will get more into this in the next video. Stay tuned.